Welcome to this series of videos on communicating with chronic pain patients. This is Module 4, Active Listening and Reflective Responses. We hear our patients all day long, but how often do we really listen? There's an important difference between hearing a patient and making a patient feel heard. And for someone with chronic pain, that difference can have a significant impact on the therapeutic relationship. Imagine a patient tells you, "I've been dealing with this pain for 3 years. I've seen 4 doctors, had 2 MRIs, tried injections, physical therapy, and medication. Nothing has worked. I'm starting to think nobody can help me." How would you respond? Our healthcare provider instinct often tells us to fix. So we might immediately say, "Well, there are still plenty of things we can try." Or, "Have you ever tried aquatic therapy?" Or, "Let me explain what I think is happening." But sometimes the most therapeutic thing we can do in that moment isn't to provide another solution. It's to demonstrate that we actually heard what the patient said. We might respond, "It sounds like you've put an enormous amount of effort into getting better, and after everything you've tried, you're starting to wonder whether anything is actually going to help." That's reflective listening, and it's a skill. Reflective listening means carefully and non-judgmentally listening to a patient and then communicating what you've heard back to them in your own words. But it's more than simply repeating what the patient said. The goal is to understand both what the patient is saying and what they mean by it. It's particularly relevant to chronic pain. Patients may arrive frustrated, defensive, or skeptical after years of unsuccessful treatment. Reflective listening communicates, "I'm paying attention. I'm trying to understand. And before I tell you what I think, I want to make sure I understand what you think." That last point is especially important. As healthcare providers, we're trained to gather information quickly and move toward a diagnosis and treatment plan. Reflective listening intentionally slows that process down for a moment. Instead of immediately asking the next question or offering a solution, we demonstrate to the patient that we've understood what they just told us. That small change can turn the encounter from an interview into a conversation. Recent research gives us a useful way to think about active empathic listening. In a 2026 study examining active empathic listening in healthcare, researchers described 3 components: sensing, processing, responding. First, sensing. Am I actually paying attention to what this patient is telling me? Not just their words, their emotion, their hesitation, their frustration, their body language. Second, processing. Am I trying to understand what this means from the patient's perspective? And third, responding. Am I communicating something back that demonstrates that I understood? That last step is critical because you can listen beautifully inside your own head. But if the patient doesn't know you're listening, it doesn't accomplish nearly as much. Reflective listening isn't simply repeating someone's words. Patient: "My back hurts every time I exercise." Provider: "Your back hurts every time you exercise." That's technically reflection, but it's not particularly useful. Instead, try to identify the meaning underneath the statement. Patient: "My back hurts every time I exercise." Provider: "It sounds like the increase in pain makes you wonder whether exercise might actually be making your condition worse." Now we've moved beyond words, and something interesting may happen. The patient might respond, "Exactly. That's what I've been trying to tell everyone." Or they might say, "No, I'm not worried about damage. I'm just frustrated because I hurt for 2 days afterward." That's valuable too. Reflective listening isn't about proving that you understood correctly. It's about checking whether you understood correctly. If you get it wrong, the patient corrects you. Either way, you learn something. Here's another useful technique. Listen not only for what happened, but for how the patient feels about what happened. A patient says, "Every doctor I've seen tells me something different." You could respond, "Sounds like you've gotten a lot of different opinions." That's a reflection of content. Or you could say, "It sounds like all those different explanations have left you pretty frustrated and confused." That's a reflection of emotion. Both can be useful, but reflecting emotion often takes the conversation somewhere deeper. Because chronic pain isn't simply a collection of symptoms. There may be frustration, fear, loss, confusion, anger, and sometimes hopelessness. If we're only listening for symptoms, we may miss the information that matters most. Here's something else to consider. Healthcare providers are trained to ask questions, and that's important. But sometimes we ask so many questions that the encounter begins to feel like an interrogation. Where does it hurt? How long? What makes it worse? What makes it better? Have you tried medication? Have you tried therapy? Have you had imaging? One question after another. Try replacing some questions with reflections. Patient: I stopped going to the gym because I'm afraid I'll flare everything up again. Instead of immediately asking, when was the last time you went to the gym? Try, getting back to the gym is important to you, but right now the possibility of another flare-up is holding you back. Then pause. The patient will often continue talking, and what they tell you next may be far more valuable than the answer to your next checklist question. There's another communication technique that may feel uncomfortable. Silence. A patient finishes speaking, and we immediately jump in. We want to fill the space. Try waiting for a moment. Give the patient time to think. Give yourself time to process. Silence communicates you don't have to rush. And sometimes after a few seconds, the patient will add, actually, there's something else. And that's often where the important information comes out. Here's a simple technique you can try tomorrow. When a patient tells you something important, resist the urge to immediately educate, reassure, or solve. Instead, listen, reflect, confirm. Listen for both the content and the emotion. Reflect what you think you heard, then confirm. Am I understanding that correctly? For example, patient: every time my pain increases, I cancel everything because I'm worried I'm going to make things worse. You might say, so when the pain increases, you interpret that as a warning that something may be getting damaged. And because of that, you stop your activities. Am I understanding you correctly? Now you've uncovered a belief that may be extremely important to treatment, and you discovered it through listening rather than lecturing. Active listening isn't passive. It's not sitting quietly while you wait for your turn to talk. It's an active clinical skill. Sense what the patient is communicating. Process what it means from their perspective. Respond in a way that demonstrates your understanding. And remember, don't listen just so you can respond. Listen so you can understand. Because before we can help patients reconsider their beliefs, change their behaviors, or engage in rehabilitation, we need to understand the story they're currently telling themselves about their pain. And sometimes the most powerful communication technique we have is also one of the simplest. Let the patient talk and show them that you were listening.